Now, let us move on to pharmacokinetics. For a drug to produce its specific response, it should be present in adequate concentrations at the site of action. Once the drug is administered, it is absorbed, is distributed to different parts of the body, reaches the site of action and is metabolized and excreted. The study of the movement of the drugs into, within and out of the body, that is absorption, distribution, metabolism and excretion of drugs is known as pharmacokinetics, or simply it refers to what the body does to a drug. Pharmaco comes from the Greek word for drug pharmakon and kinetics comes from the Greek word for moving kinetikos. Most drugs are administered orally as tablets. A tablet is a compressed powder mass that consists of the active drug, which usually comprises only a small portion of the overall tablet and other compounds required for either the manufacture of the tablet, that is diluents, lubricants, etc., or to optimize the characteristics of the finished product, that is color, taste and hardness. Once a tablet is swallowed, it enters the stomach, where the drug contained within the hard powder mass must be exposed and released. The tablet must first disintegrate into small particles to enable the drug to dissolve in the gastrointestinal fluid. When the drug is dissolved in the GI fluid, it has the opportunity to pass across the epithelial cell lining of the gastrointestinal membrane and get absorbed into the blood on the other side. Once in the circulatory system, the drug has to pass through the liver, which is a major organ of drug elimination. The absorbed drug may undergo elimination by metabolism during its first pass through the liver. After the liver, the drug is taken to the heart, which pumps the drug throughout the entire circulatory system. At this point, the drug has been absorbed. The rate and extent of absorption of a drug are very important determinants of the early plasma concentrations of a drug. Rapid rates of absorption will promote high early plasma concentrations. Once the heart pumps the drug around the body, the drug is given the opportunity to distribute to all the tissues, including the biophase or site of action. A drug's distribution pattern, particularly the rate and extent to which it distributes to the tissues, is also an important determinant of the early plasma concentrations. The greater its distribution to the tissues, the lower will be the remaining plasma concentration. The plasma concentration will also be influenced by drug elimination, which occurs as soon as the drug is in the plasma. The main pathways of elimination are hepatic metabolism and renal excretion. The process of drug elimination will continue to affect the plasma concentration until the drug has been removed from the body completely. In this figure, you can see a schematic representation of movement of drug in the body. Now, let us move on to the routes of drug administration. Drugs may be administered by various routes. The route of administration is determined by the properties of the drug. For example, water or lipid solubility and ionization, and by the therapeutic objectives. Example, the desirability of a rapid onset, the need for long-term treatment or restriction or delivery to a local site. Here you can see the major route of administration include enteral, parenteral and topical.